I'm Dr. Catherin Harris, and today I want to talk to you directly about a myth that has created confusion, shame, and unnecessary conflict for years. The idea that female sexual desire is low. What if I told you that for many women, desire isn't low at all? It's simply misunderstood, mislabeled, and mismanaged by the stories we've been told? If you've ever wondered why you don't feel desire the way you're supposed to, or why desire seems to arrive on its own terms, you're not broken. You're human. You're responsive to context. And once you understand how desire actually works in real life, not in movies, not in a culture of urgency, you'll start recognizing that your body has been whispering the truth all along. Let's start by naming the script many of us inherited. Desire should be spontaneous. It should strike like lightning. It should be immediate and constant if the relationship is right. And if you don't feel it right now, something is wrong with you, with your hormones, or with your partner. That script is not only inaccurate, it is often the opposite of how female desire operates. For many women, sexual desire is primarily responsive, not spontaneous. Responsive desire doesn't kick the door down. It waits for the environment to feel safe, connected, and meaningful. It shows up when the brakes are released and the accelerators are gently pressed in a context of trust, curiosity, and enough time. That's not a flaw, that's design. Think of desire like a delicate ecosystem, not a light switch. In an ecosystem, many elements must be in balance: sleep, stress, the mental load you carry, the quality of emotional connection, your sense of safety in your own body, how comfortable you feel saying no, and how empowered you feel to say yes. If you live under constant stress, your brain is trained to scan for danger, not intimacy. If you're exhausted, you won't crave novelty. You'll crave rest. If you're managing children, work deadlines, family expectations, and a world that judges women for having too much desire and too little desire in the same breath, your body cannot instantly pivot into sensuality. That doesn't mean you lack desire. It means your brakes are stronger than your accelerators right now. Brakes and accelerators are a useful way to understand what's really happening. The brain has systems that turn sexual response up and systems that turn it down. Sufficient novelty, trust, playfulness, and emotional safety push the gas. Stress, anxiety, unresolved conflict, body shame, pain, and fear press the brakes. If the brakes are fully on, it doesn't matter how hard you press the gas. Nothing moves. The solution isn't to slam the accelerator, it's to gently release the brakes. Let's walk through the most common brakes. First, stress and time pressure. When your day is broken into micro tasks and you're switching roles every hour, your brain doesn't associate home with rest and intimacy. It associates home with more work. Desire is sensitive to mental clutter. The longer your to-do list, the shorter your path to not tonight. This isn't moral weakness. It's neurobiology. Your nervous system must downshift from doing to being before it can open to desire. Second, unresolved relationship tension. You can love someone deeply and still have accumulated micro-injuries, snarky comments, broken promises, emotional distance. These do not vanish at bedtime. They linger as subtle breaks, telling your body to guard rather than soften. Third, body image and performance pressure. When you're busy evaluating yourself from the outside, you can't inhabit yourself from the inside. Desire is an inside-out experience. It evaporates under surveillance. Fourth, lack of safety or past trauma. The body keeps the score. If your nervous system associates intimacy with danger, it will protect you by shutting desire down. That's not dysfunction, that's self-preservation. Fifth, pain or medical issues, vaginal dryness, pelvic floor tension, endometriosis, infections, untreated thyroid problems, anemia, diabetes, medication side effects such as certain antidepressants or hormonal contraceptives. Physical factors matter. They are not excuses. Finally, a missing bridge between daily life and intimacy. Many couples simply don't have a reliable on-ramp that honors how desire wakes up. Gradually, with cues, with space, with gentle sensory invitations rather than immediate expectations. Now, what are the accelerators? Emotional attunement, playfulness without pressure, feeling seen and respected, intimacy rituals that begin long before bedtime, moments of affectionate touch that carry no agenda, words of appreciation that don't ask for anything in return, shared laughter over inside jokes. Curiosity about your partner, yes, but also about yourself. The permission to say, I don't know exactly what I want tonight, but I want to explore what feels good, is an accelerator. So is agency. Desire thrives when consent is enthusiastic, when no is welcomed as information and yes is celebrated as a gift. Context matters. For some, a tidy space matters. For others, music or softness or warmth is the cue. The light in the room, the pace of the evening, the sense of privacy, the absence of rush, these seemingly small elements are actually the conditions under which desire breathes. Let's name something else that's rarely explained. The difference between arousal and desire. Desire is a psychological readiness, the inclination toward intimacy, the wanting. Arousal is the body's physiological response, the happening. Many women are told they must feel desire first to then become aroused. In reality, for many, gentle arousal cues can help awaken desire. One doesn't need to precede the other in a fixed sequence. Your body may begin to relax with affectionate touch or with playful conversation or with a warm bath. Your mind then interprets those signals as safety and begins to invite desire. That's not backwards. That's one of the many normal pathways to intimacy. When you stop judging the timing of your desire, you give it a chance to arrive. So why do we get stuck? Because we're comparing ourselves to a myth. The myth says lightning or nothing. The reality says kindling, spark, flame. The myth says, if I don't feel it immediately, I shouldn't say yes. The reality says, I can say yes to curiosity and see if desire joins me once I feel safe. The myth says desire should be the same every week of the month and every year of your life. The reality says hormones, sleep, life transitions, grief, childbirth, perimenopause, medications, and relationship dynamics all shape desire. That variability is normal. It doesn't make your desire less valid. Let's talk about life stages, because desire is not a static trait. It's a living process. In adolescence and early adulthood, a developing sense of self, inconsistent body confidence, and social scripts can create confusion. Am I supposed to want this right now? Many discover that their true desire emerges not in the loudest environments, but in the safest ones. In the late 20s and 30s, competing demands, career, caregiving, fertility planning, can squeeze the oxygen out of intimacy. Postpartum, sleep deprivation, identity shifts, and body healing create the most intense breaks many women will ever experience. None of this is pathology. It's physiology plus context. Gentle re-entry into intimacy, with zero pressure and plentiful affection, allows desire to return in its own time. In the 40s and 50s, shifting hormones, perimenopausal symptoms, vaginal dryness, and mood variability can alter desire's rhythm. That doesn't mean the end of your vibrant sexuality. In fact, many women report deeper, more grounded desire once they have the education, the tools, and the language to ask for what actually works for them. Menopause and beyond can bring freedom from fertility concerns, a clearer sense of boundaries, and a new appreciation for pleasure as nourishment, not performance. With the right support, medical guidance when needed, pelvic floor therapy if indicated, sensitive communication, desire can flourish at any age. Let's also acknowledge the medical side with clarity and care without turning this into personal medical advice. Certain medications can dampen desire, particularly some antidepressants. That doesn't mean you should stop them. It means discuss options with a clinician who listens. Thyroid disorders, iron deficiency, poorly managed diabetes, chronic pain conditions, and pelvic health disorders can all press the brakes. Vulvovaginal dryness and pain can make the body associate intimacy with discomfort, understandably shutting down interest. These are treatable issues. Your discomfort deserves attention. Pelvic floor physical therapy can be transformative for some. Local vaginal estrogen may help for dryness after menopause. For specific diagnoses like hypoactive sexual desire disorder in premenopausal women, medications exist that might be considered under medical supervision. None of these are magic bullets. They're tools that may help when tailored thoughtfully. What's most important is that you feel empowered to voice your experience and to be met with respect, not dismissal. Now let's turn from understanding to skill. Desire grows where it is cultivated. It fades where it is shamed, rushed, or ignored. Cultivation is not manipulation. It's care. Start with nervous system regulation. You cannot sprint out of your day and expect your body to instantly open. Build a transition ritual, a consistent, short sequence that tells your nervous system, we are shifting from doing to being. This might be a 10-minute tidy and dim routine, a warm shower, slow breathing on the couch with a soft blanket, or stepping outside to feel the evening air. Add one sensory cue you love, sound, scent, or touch, and use it every time. You are training your body to recognize a doorway to intimacy. Communication is the second skill, and it's not just about words. It's about timing, tone, and intention. Think of 4 conversations that transform intimacy. The first is the meaning conversation. What does sex mean to each of you? Connection, play, stress relief, reassurance, exploration, worship, mischief, comfort? If you've never named it, you will talk past each other. The second is the boundaries conversation. What is a clear no for each of you, and what is a not yet? Boundaries invite trust. They don't reduce desire, they protect it. The third is the feedback conversation. How can we give real-time guidance without shame? Create a shared phrase that means slow down, another that means more of that, and another that means let's reset. The fourth is the aftercare conversation. How do we close the loop in ways that help the body imprint the experience as safety and satisfaction? A glass of water, a quiet cuddle, a whispered appreciation, these small rituals teach the nervous system that intimacy ends in connection, not critique. If you're partnered, address the mental load explicitly. Desire cannot flourish beneath resentment. Make the invisible visible. List the cognitive tasks you hold. Planning meals, scheduling appointments, tracking birthdays, remembering school projects, managing family dynamics. Share the load fairly, not just the chores, but the responsibility for initiating and tracking. A partner who shows up for life outside the bedroom liberates desire inside it, not because chores are erotic, but because true partnership reduces the brakes. Let's practice a simple exercise I call the desire map. Take a sheet of paper and draw 3 columns: accelerators, brakes, and bridges. In the accelerators column, write anything that predictably helps you feel open. Kind words, a slow evening, music, laughter, compliments that land as sincere, privacy, warmth, feeling unrushed. In the brakes column, write the usual suspects: stress, clutter, conflict, criticism, feeling unappreciated, body discomfort, pain, performance pressure, phones in the bedroom, a cold room, a late dinner, exhaustion. In the bridges column, write the small practices that move you from busy to present. A shared walk, screens off, 5 minutes of eye contact, a 20-second hug, a 6-second kiss, stretching together, a short mindfulness practice, a bath, exchanging appreciations. This map is not a wish list, it's a living guide. Share it with your partner, not as demands, but as insight. Then pick one bridge for this week and do it 3 times. You are building a reliable on-ramp. Mindfulness deserves special attention because it teaches you to be in your body with kindness. Many women report that their mind keeps leaving the moment, planning tomorrow, replaying a comment, worrying about how they look. Mindfulness brings you back with compassion. Try this. Place one hand on your heart and one on your lower belly, and take 5 slow breaths, counting to 4 on the inhale and 6 on the exhale. Notice sensation: warmth, skin, breath, weight on the bed or couch, the sound in the room. If your mind wanders, gently escort it back without judgment. Practice for 5 minutes a day, not just during intimacy. You are cultivating the muscle of presence. Presence is the soil of desire. Touch can be retrained too, gently, respectfully, without goals. There is a form of practice called non-demand touch, which means you set aside time for affectionate, curious touch that has no endpoint other than enjoying comfort and connection. Think of it as a conversation in sensation, not a performance. If you're partnered, take turns being the giver and the receiver for a set number of minutes. The receiver's job is to notice and share what feels comforting: pressure, pace, location, without worrying about the other person's feelings. The giver's job is to listen with their hands and adjust without taking anything personally. If either of you becomes goal-focused, pause and breathe. You are building trust in your bodies and in each other. Let's not forget pleasure education. Many people were never taught accurate, shame-free information about how women's bodies respond to pleasure. Desire is easier to access when you're confident you can create comfort and pleasure without pain or pressure. That includes practical basics like using lubrication generously when needed, especially with hormonal shifts, recognizing that arousal often precedes comfort, and understanding that taking time is not a flaw, but a feature. Pleasure is not a race, it is a landscape. Exploring it with patience is not indulgence, it is wisdom. If you are single, this conversation is just as relevant. Your relationship with desire begins with your relationship to yourself. The same accelerators, brakes, and bridges apply. You can create rituals that help you feel grounded and connected to your own body. Practice mindfulness to inhabit yourself more fully, and build a respectful inner dialogue that asks, "What do I truly want right now?" rather than, "What should I want?" The quality of your future partnerships often mirrors the quality of your self-relationship today. Learning to honor your boundaries and your curiosity now will save you from performing someone else's script later. Let's talk briefly about cultural scripts, because they shape what we believe is possible. A common script tells women that they must either be endlessly available or morally superior by withholding. Both scripts erase the complexity and dignity of real desire. Another script says that if you communicate needs, you're needy. In truth, communicating needs is how adults build intimacy. A better script sounds like this: my desire is worthy of respect. It changes with context. I have permission to ask for the conditions that help it blossom, and permission to rest when it needs rest. I will not pathologize myself for being responsive rather than spontaneous. I will cultivate environments that help desire find me. Now, if you find yourself thinking, "That all sounds nice, but I still don't feel desire," let's troubleshoot compassionately. Start with the simplest levers. Are you sleeping enough to feel human? Sleep is not a luxury. It is emotional first aid. Are you moving your body regularly? Gentle movement improves mood, circulation, and connection to bodily sensation. Are you eating in a way that stabilizes energy rather than spikes and crashes it? Blood sugar swings are desire's enemy. Are you hydrating? Are you giving yourself even 10 minutes a day that belong only to you, not to work, not to family, not to a screen? This is not self-care cliché. It's nervous system regulation. Without it, desire must fight an uphill battle every time. Next, address relationship hygiene. Are there apologies owed? Are there appreciations unspoken? Is there a small repair you can initiate today without keeping score? Nothing amplifies desire like kindness and accountability. If you're holding resentment, name it gently and ask for a collaborative solution. If you've been minimizing your own boundaries to keep the peace, Reclaim them. Desire does not thrive where your no is swallowed. Your no makes your yes meaningful. If pain has been a part of your experience, seek evaluation with a clinician who takes sexual pain seriously. You deserve providers who listen and problem solve with you. Pelvic floor therapy can help with muscle tension, scar sensitivity, and coordination. Gentle dilator work under guidance can restore comfort. Local therapies can address dryness. Trauma-informed counseling can help your body relearn safety. None of this is a quick fix, but each step reteaches your nervous system that your body is a safe home for desire. Let's bring your partner into the conversation with a practical framework. Share this 3-part agreement. First, we will treat desire like a fire we tend together. We'll plan for it, not to force it, but to make space for it. That means we'll protect time, control distractions, and create an atmosphere we both enjoy. Second, we will separate affection from outcome. We will give and receive touch that is not a secret contract for anything else. Affection is the soil. Outcomes are the fruit. Third, we will practice curiosity instead of certainty. We will ask, what would make this 5% better right now? Instead of, why don't you want me? The first question invites collaboration. The second triggers shame and defense. Here are some sentences you can borrow. I want to want. Can we slow down and build a bridge together? My brakes are on after today. Could we reset the room and start with just holding each other? I feel safest when I know we can stop or change course at any moment. Can we use our pause word? I loved when you told me what you appreciated about me earlier. That helped me feel open. Could we try a no-pressure, 20-minute cuddle and see what my body says once I've landed? These are not excuses. They are invitations. They honor how your desire works. Now, I want to address a myth about scheduling. People sometimes say scheduling intimacy kills spontaneity. But spontaneity without support is just neglect with optimism. Scheduling isn't about putting your joy in a calendar. It's about protecting it from everything else that will colonize your life. If you plan a cozy, unrushed evening with the option, not the obligation, of intimacy, you are giving responsive desire the conditions it needs to appear. If desire doesn't show up, you still created a nourishing evening together, which is itself an accelerator for next time. Let's talk about self-compassion, because nothing suffocates desire like shame. If you've internalized the story that you're broken, frigid, or failing, your nervous system will brace even before the evening begins. Replace the shame stories with accurate, kind truths. Try this affirmation. My desire deserves time, safety, and play. My worth is not measured by my frequency. I can be both tired and worthy of pleasure. I can change my mind. I can ask for what I need. Pleasure is not a performance. It is a conversation. Say it out loud if you need to. Your body listens to your voice. What about when partners have different desire patterns? That's almost everyone. The solution is not to declare a winner, it's to build a bridge. The higher desire partner can learn to savor affection and closeness without expecting escalation every time, trusting that these deposits build a richer erotic life. The lower or differently desiring partner can experiment with gentle curiosity, allowing for maybe nights where exploration is welcome and stopping is celebrated as success if that's what the body wants. When both people honor the other's nervous system, desire finds its way back to the middle. Before we close, I want to give you a simple weekly blueprint you can adapt. Choose one connection ritual that takes 5 minutes a day. A gratitude exchange, a slow hug, or 10 minutes of screen-free conversation. Choose one longer ritual once a week, perhaps a shared walk, cooking together, a bath, a massage exchange without goals. Choose one intimacy window on the calendar, protected from late-night work, protected from phones. Prepare the space together, clean sheets, dim lights, a comfortable temperature, water by the bed, lubrication within reach if useful, music you both like. Begin with a bridge you've both agreed on. Keep communication open and kind. If desire arrives, welcome it. If it doesn't, you've still nurtured your connection. Repeat next week and watch what changes. Real desire loves reliability more than novelty, safety more than spectacle. If you're listening to this and a part of you feels grief for the years you believed you were broken, please know you are not alone. Many women and many couples have lived inside that story for too long. Today can be the day you choose a different one. Your body is not the enemy. It's your ally. It has been protecting you, and it will also guide you back to pleasure when the conditions are right. You do not need to force yourself into somebody else's template. You can author your own. When I say female sexual desire isn't low, I'm not denying that desire can be difficult to access sometimes. I'm saying that the difficulty usually has reasons, not defects, and that reasons can be understood and addressed. With compassion, with education, with medical support when appropriate, with communication and tiny daily rituals, desire becomes less a mystery and more a garden. Gardens don't bloom because you demand it. They bloom because you learned what each plant needs and you gave it consistently. So here is your invitation for this week. Draft your desire map with accelerators, brakes, and bridges. Share it, or if you're single, honor it for yourself. Choose one 5-minute ritual for every day, one longer ritual for once this week, and protect one intimacy window with no pressure. Prepare your nervous system with a transition routine and a few slow breaths. Use one new sentence that communicates your needs with clarity and kindness. And at the end of any connection, whatever form it takes, close with aftercare, appreciation, warmth, and a sense of completion. These aren't small things. They're the architecture of trust, and trust is the condition under which desire returns again and again. You are not behind. You are not broken. You are learning a language you were never taught. And like any new language, it begins awkwardly, with simple sentences and generous pauses. Then, one evening, you notice that you're not translating anymore. You're speaking it. Your body says yes more easily. Your mind quiets. Your heart feels safe. That is not an accident. That is a nurtured desire finally given its chance to live. I'm Dr. Catherin Harris. If this conversation helped you, share it with someone who needs to hear that they're not broken. Keep learning, keep practicing small rituals, keep telling the truth kindly, to yourself and to each other. Desire isn't a test you pass. It's a relationship you tend, and it's worthy of your best care.